What is ptosis? Well, ptosis is a condition where the margin of the eyelid, the area where the eyelashes come out from, is actually sitting too low. It's different from conditions where there is too much upper eyelid skin. We refer to these conditions as dermatochalasis. So that's a really important distinction to be aware of. Ptosis means that the actual margin of the upper eyelid is sitting too low. Now, in adults, there are many different kinds of ptosis. Involutional is the most common. Really, that just means age-related, and it's due to a stretching of the muscle. But when you go in to see your oculoplastic surgeon for an evaluation, they'll be looking to make sure that there aren't other underlying causes for a droopy eyelid. This can include a variety of neurologic causes, or even some problems with the muscle that can be associated with other conditions affecting the rest of the body. So it's really important to have a proper exam to make sure that your droopy eyelid is in fact age-related. Now, if the droopiness or the amount of ptosis is very small, it's probably cosmetic in nature, right? We notice this in asymmetry between the two eyelids, and there are certainly things that can be done from a cosmetic standpoint to improve this. If it only bothers you on rare occasion, for example, you're giving a big presentation at work, or you're in your child's wedding photographs, or something really important that doesn't happen that often, then I think it's reasonable to consider some of the non-surgical treatments that are out there. Upneek is a drop that has been approved for use in patients with ptosis. The active medication in it is oxymetazoline. This is the same medication that's in some nasal sprays. And basically this drop works by causing contraction of the muscle that lifts the eyelid to elevate the margin of the eyelid so that the eyes are more wide open. It only lasts for about 8 hours though, and so I think it's not a great option if your droopy eyelid, your ptosis, bothers you on a daily basis, because then you always have to be taking these drops and they can be quite costly. If it bothers you on a daily basis, then surgery is probably a better solution, even if it's mild and cosmetic in nature. Now, on the other end of the spectrum is people with very severe ptosis. When the eyelid is really droopy, it can definitely impair your vision, both in terms of decreasing the amount of light getting into your eye, which can be troublesome if you have other eye conditions like macular degeneration or glaucoma. But it can also limit your visual field, meaning that it's difficult to see things above you or to the side of you. And both of these are good reasons to do ptosis surgery. Now, there are many different techniques for ptosis surgery. We can get into that in a surgical video later, but in general, ptosis surgery has a fairly high success rate. I would say about 90% of patients have an improvement in the position of the eyelid to a degree that they're happy with, and it's relatively safe. So if you have cosmetic ptosis that bothers you on a daily basis, or visually significant ptosis that's quite severe, I think it's certainly worth being evaluated to see if you're a candidate to have it repaired.